and welcome to Everyday Simple Somatics, a podcast dedicated to helping you find healing through your body's natural wisdom. I'm your host, Dr. Christine Baker. And today we are going to talk all about how trauma and chronic stress actually dysregulate your nervous system. So I've made this statement like all throughout the past handful of episodes, just that when we experience that, we have more dysregulation in our body. I want to explain why that is, because I really believe that when we understand how it happens, it really gives us clarity around steps forward in our recovery process. So if you are new to this podcast, my name is Dr. Christine Baker. I've been working in trauma recovery for over 13 years. I'm also a somatic experiencing practitioner, which means that I am someone who strongly believes that trauma is stored in our body, and therefore the body must be a partner in our recovery from that trauma, which is exactly why I created this podcast. Typically, this podcast will be 10-minute episodes giving a somatic skill for a specific mental health need, a relational need. However, we are currently in a 10-day series called The Essential Foundations. And the idea behind these episodes is I wanted to make sure that everyone had a general understanding of the nervous system and somatic therapy before we started going into those specific practical interventions. So if that sounds like something you might be interested in, I'd love to invite you to like and subscribe to this podcast on whatever platform you are listening to it or watching it on. Those little clicks really do help others find this resource, and so I very much appreciate it. Okay, as everyone has heard, either in this podcast or I'm sure just in the general world, because this book was so famous, as Dr. Bessel van der Kolk says, our body keeps the score. So when we experience trauma and chronic stress, our body is impacted because our nervous system adapts to help us survive. So these adaptations, and we're going to talk more about that in just a second, were protective at the time. But now that we are out of that traumatic situation, those adaptations can create challenges when they're persisting past when the danger has passed, right? And so I want to talk about 4 main ways that trauma and chronic stress cause dysregulation to our system. So the first one, and we've kind of talked about this a little bit in a previous episode, is that it narrows our window of tolerance. So things that once felt very manageable and doable now feel completely overwhelming because our system has become more sensitive to potential threats. And that makes sense, right? Because we have experienced either some kind of shock trauma or some kind of developmental consistent trauma in our life or consistent chronic stress that has shown our body there is threat out there that is going to shock you, so I need to be hyper aware, or there is threat out there that's always going to be there, hence the kind of developmental trauma, and so I need to always be aware. It causes your system to be more on guard, which is what causes that window of tolerance to shrink. Right? Because it's like, if I am needing to go into hyper arousal more often, then that window needs to be smaller so that I can jump into it quicker. Because guess what? There was probably a time when I wasn't hyper aware that I got hurt. And so now my body is saying, I need to be hyper aware more often. Right? So that's the first way. It narrows your window of tolerance. Second, it really disrupts those natural rhythms of activation and rest. Because we can get stuck in these more high alert places, like I just mentioned, that hyper arousal, or in these shutdown dissociative places, which would be kind of like those times where we realize that we cannot fight this threat, we cannot run away from this threat, and so therefore we just kind of like drop to the ground, play dead, and hope for the best, right? Like that would be that hypo arousal place, that shut down dissociative place. When we live a lot of life in that hyper or hypo aroused place, we have lost that like flexibility between activation and rest. Our body believes that we don't need to live in the green. We need to be living in the blue or in the orange, right? And I'm using those colors, referring back to the episode on window of tolerance. So if you missed that, definitely jump back there. But yeah, so that's the second way. It really disrupts these natural rhythms of activation and rest. Third, it changes our relationship with our body. I've talked about this in previous episodes. One of the most important things about regulation is that regulation happens in relationship. And one of those primary relationships is the relationship with our body. When we have experienced chronic stress or trauma, our nervous system starts to believe like this is too much to continue to connect to, right? Like this is too overwhelming. And so one of our coping skills is to disconnect from sensations. And that's going to make it way harder to practice what we've been talking about in these episodes of befriending your body and allowing your body to become your partner in recovery and mental health journey, right? And so that's a huge piece of it. It really changes our relationship with our body. And then finally, it impacts our capacity for connection with others. Dr. Stephen Porges talks about this a lot, that trauma can really impact our social engagement system, which is that ventral system. It's that green section of the window of tolerance, and that can make it way harder to feel safe with others. And if we don't feel safe with others, we're not going to be able to have healthy, deep, growing relationships, right? So those are some of the ways that trauma impacts our system. But here's the big takeaway I want you to hold on to. I know that can feel hard and sad and scary, but I want you to know that these changes are not permanent. Take that in. Our nervous system has incredible capacity to heal. I've seen it in my own life. I've seen it in so many clients' lives. There is hope for this to be different. Understanding these impacts of trauma and chronic stress is not about pathologizing yourself, right? We are just recognizing where we need to bring more attention and care, more nurturance to our nervous system. And so I'd love to just take a second to do a little somatic practice together that kind of honors the understanding that we just talked about together in this podcast, okay? So I'd love to invite you to just place one hand on your heart if that feels comfortable. If that feels like too much, just imagine that you're placing your hand on your heart. And I'd like for you to just silently acknowledge the ways that your system has worked to protect you in the past. And then if it feels okay, I'd love to invite you to just take a few breaths. And with each breath, you're just imagining making more space for new patterns of safety to emerge. We don't have to rely on those old patterns. We can create new patterns together. So with each breath, there's just a little more space for something new. Okay. I hope that this episode was helpful just in understanding what has happened and understanding what the path forward could look like. Tomorrow will be our final episode in our Essential Foundations classes, this little 10-day series that we're starting off this podcast with. And we are going to be talking all about a daily nervous system regulation rhythm, why that's important, and what it could look like. Okay. So that'll be our last episode in this series. So if this episode has been helpful for you, or if you think that future episode could be helpful, I'd love to invite you to like and subscribe to this podcast on whatever platform you are watching or listening. And then if you'd like to dig even deeper into some of these concepts, I'd love to invite you to consider joining us in the Somatic Wellness Collective. There is a link in the show notes that you can learn all about what we offer, but ultimately it's a affordable monthly learning community that really digs into these concepts that we talk about in this podcast in a much deeper way and learns how to apply these to our own personal lives. So it's a really sweet group of people, and I hope you'll consider joining us. Remember, your body has innate wisdom. We just need to learn how to listen, and that's what I'm here for. I'll see you next time.